Hi, I'm Leanne McGee. I'm a pediatric psychologist with the Children's Hospital of Philadelphia Cleft Lip and Palate and Craniofacial teams. Today, I'll be providing an overview of the psychosocial impacts of cleft lip and palate and associated care throughout childhood. We're going to focus on strategies that parents and caregivers can use to help their children and teens cope with medical care, appearance concerns, and social challenges in ways that can help build resilience and increase quality of life. Children and families affected by cleft lip and palate will face various challenges throughout the stages of care. Early on, our families are tasked with learning about and accepting a diagnosis and coping with medical and surgical care, often while managing interventions to facilitate feeding, growth, and development. As kids age, they become aware of the challenges and complexities of their medical visits and surgeries, while also navigating difficulties with school and complex social dynamics in their school and community environments. For many, this can include coping with social difficulties, teasing, or body image and appearance concerns. Despite the many challenges across the lifespan, most kids with cleft and craniofacial conditions exhibit very strong psychosocial outcomes. However, they also experience some heightened risk factors relative to their unaffected peers. This can include lower self-esteem, higher rates of internalizing disorders like depression and anxiety, higher rates of externalizing disorders, including behavior challenges, higher rates of teasing, and lower satisfaction with facial appearance. Among our teens with cleft and craniofacial conditions, research shows that their psychological adjustment is predicted by their perceived problems with their speech, their coping styles, their social experiences, including the frequency and quality of their social interactions, their family support, their social stressors, and the presence or absence of teasing and bullying, as well as their satisfaction of appearance, which tends to increase with age. How we look plays a role in our psychosocial functioning, including our quality of life and our social interactions. Research across adults with visible differences of all causes suggests that while many adjust well, some will struggle with appearance and experience significant psychological and social impacts, which can include low self-esteem, body image concerns, and difficulties with social interactions. Appearance concerns can often be closely related to the experience of anxiety and depression and can include fears of being negatively evaluated by others, perceptions of stigmatization, negative thinking patterns, including critical self-talk, and behavior changes, including avoiding social situations, as well as other emotional reactions like anger, guilt, and grief. However, the extent to which someone experiences difficulties due to appearance differences is mediated by resilience factors, including coping styles, thinking styles, behavioral responses, and social supports. Negative social experiences, including teasing, can have a profound impact on psychosocial functioning for youth with cleft. Teasing is relatively common, with 25 to 35% of the general population experiencing it. However, it's 5.5 times more likely to be experienced by kids with cleft and craniofacial conditions. Teasing happens throughout childhood, often onsetting in preschool, generally early elementary, peaks in middle school, although we're seeing a little bit of a peak between 3rd and 5th grade, and it tends to decline by high school. Bullying can include physical aggression and violence, verbal comments or threats, relational aggression like social exclusion, and increasingly includes cyberbullying, which has seen a 70% increase since the onset of COVID-19. Some of the trickier aspects of cyberbullying is that it can be anonymous, involve targeted or unlimited audiences. It can happen at any time, anywhere, and can be really hard to supervise and investigate. Since the start of the pandemic in early 2020, there have been some additional challenges for our patients with cleft and their families. Social isolation contributed to the loss of regular contact with peers and limited engagement in fun activities in the community. This isolation was associated with reports of loneliness, increased reports of mental health concerns, including depression and anxiety, and a lot of challenges accessing support resources. Once kids and families were engaging in their communities, the regular use of masks helped to keep people healthy, but it also presented challenges for individuals with speech and hearing difficulties and really impacted the quality of social interactions. In addition, masking also conceals facial appearance. For some of our cleft and craniofacial patients, they welcomed the anonymity that came with masking, and others expressed anxieties about having to reveal their facial appearance once masks were removed. Increased time online during the pandemic contributed to a lot of increases in self-consciousness about appearance as kids spent more time being viewed by others online for school and social activities. They can see their own faces on screen when they participate. More time online also meant more opportunities for cyberbullying, included reports of kids having unkind comments in Google Class, other students taking unflattering screenshots of Zoom screens, or bullying through social media and text. In addition, a lot of time online often meant limited in-person academic supports and developmental therapies for many of our kids and families. And lastly, the transition to the so-called new normal has introduced some new challenges, including lots of variability in concerns and risk tolerance based on a particular family's health status, their community setting, and their family practices. A lot of our kids and families reported anxiety about returning to school and social settings, whether it was due to concerns for their health, self-consciousness about unmasking, or difficulties just readjusting to school and social routines after a year of more stressful but often more flexible routines. So we can appreciate that our kids with cleft and craniofacial conditions certainly face challenges related to their medical and surgical care, the psychosocial impact of their condition and their appearance differences, and heightened risks for social challenges, including teasing and bullying. And we know that these challenges were intensified by the pandemic. But we also know that resilience is a key factor in mediating the impacts of these challenges. Resilience is the ability to adapt well to adversity. A resilient person copes and bounces back when faced with stress, change, or risk factors. Someone who has resilience can identify problems, find ways to address challenges, recover quickly, and move on. And I think perhaps most important, resilience is something that can be learned and taught. So why is resilience important? It's what helps our kids and our families bounce back from the challenges they face throughout all stages of their cleft and craniofacial care. It doesn't mean that they won't experience hard times, but it means that they're going to have the tools and the supports to respond to these challenges. Greater resilience has been associated with many positive outcomes, even in the face of adversity, including improved abilities to face challenges, the ability and desire to help others, and even broader outcomes like better health, longer life, feeling happier in relationships, being more successful in school and work, reduced mental health distress. Resilience is created through a combination of internal and external risk and protective factors that are all around us. And while we can't always control all of these, we can have some influence on minimizing our risks and maximizing our protective factors. That often means being able to really understand what are our relative risks and protective factors for us and our kids. From within, we each have varying skills and capacities related to emotion regulation, self-control, self-efficacy, or our belief in ourselves to be able to do things, as well as our critical thinking and problem-solving skills and overall confidence and outlook on our situations. Outside factors can include the supports we receive from the systems in which our kids live. That's our families, our schools, our healthcare providers, our communities that surround us, and the existence of positive role models and caring relationships and connections within these networks. As caregivers, you're in a powerful position to help build resilience in your child. Fostering resilience can be especially important if our kids are experiencing challenges like the medical and surgical stressors, social challenges, appearance concerns, or mental health challenges. Promoting resilience in kids is not a single event. It's a continuous, ongoing process that requires adults to be supportive and empathetic when things are not going our way. It requires you as a parent to have an understanding of resilience, both your kids and your own, so that you can have faith in yourself and in your child's ability to cope. Resilience involves behaviors, thoughts, and actions that can be learned over time. Research has identified a common set of factors that predispose children to positive outcomes in the face of significant adversity. These include facilitating supportive adult-child relationships, building a sense of self-efficacy, that I can do it, and perceived control, providing opportunities to strengthen adaptive skills and self-regulation capacities, and mobilizing sources of support from faith, hope, and cultural traditions. The single most common factor for kids who develop resilience is at least one stable and committed relationship with a supportive parent, caregiver, or other adult. This relationship can provide personalized responsiveness, support, and protection that buffers kids from adversity. These relationships also help kids build their capacities to plan, monitor, and regulate their behaviors in ways that help them adapt and thrive. This combination of supportive relationships, adaptive skill building, and positive experiences is the foundation of resilience. So, as a caregiver, you're likely already doing many of these things to foster connection and resilience in your kids. But some strategies, just to review, can include paying positive attention, showing affection, making time to play, and providing supportive comfort. Importantly, providing comfort doesn't always mean that as a caregiver, we should take away our child's challenges. Sometimes the best thing that we can do is to hold their hand and be with them as they go through something hard. You can also connect with your child by really listening to them. If they feel connected to and safe with you, they will be much more likely to share their struggles with you and trust that you can understand or try to understand their experiences. When your child shares with you about a tough time that they're facing or fearing, it's important to show empathy. So if they report feeling sad or scared, rather than saying there's nothing to worry about or you'll be okay, try saying something more like, wow, that sounds really tough for you. What do you think we can do to help make it better? Lastly, you can share stories from your own experiences, your child's early experiences, or even their favorite books and movies to help connect them with the experience of overcoming difficulties. Recalling how maybe in the past they've demonstrated bravery or coping can help them remember that they can handle this and that they've got support and that they're not alone. As a caregiver, you can also encourage resilience through your child's ongoing medical, dental, and surgical care. This can involve a lot of different strategies before, during, and after this care is delivered. First, you want to know your child's unique risk and protective factors. That's going to help you figure out how best to support them. If you know they have a particular area of risk, personally, situationally, or within your family, then that might be an area that you work really hard to provide some extra supports. You're going to want to share appropriate information with your kid and keep them involved at all stages of the care process. That means discussing with your kids at a level that's appropriate for their age, what their condition is, what their treatment is going to involve. We want to give them honest information. Try to use language that is simple and descriptive. Let them know what we're doing, why we're doing it, and what it's going to help with. Don't let your kids hear more than you want them to. Just because you're not talking to them doesn't mean that they're not listening. If you need support or feel like you need to discuss more complex details of their care, maybe find a way to do that apart from their child. But importantly, don't shut your kids out of their care process and don't keep secrets. Nothing challenges trust in parents and their medical providers like telling a lie about what's happening. We really want to trust in our kids' ability to cope with these hard situations and provide appropriate supports. The next thing we want to do is plan for procedures. We want to learn about what our kids are going to be facing, what's going to happen, where, when, how long is it going to take, what might it feel like. Some kids do better with a few days or even weeks to prepare for a medical visit or procedure. Others might worry excessively and do better with much less notice. So again, knowing your kids' unique risk factors will help you figure out the best approach. You want to communicate at a level that works best for your child so they know what to expect and when. If a procedure is going to cause physical or emotional distress, let's be prepared. We don't want to pretend it's not going to happen. We want to then just pull in the support from our care teams, your medical providers, psychologists, or child life specialist, or even just distraction strategies or positive reinforcement and rewards for getting through a hard procedure. When we can, we do want to give our kids choices. Now, some medical procedures must be done no matter what, while others are more flexible. Find out from your providers what options you have. And if there's an opportunity for choice, it might help your child feel more in control of the situation. We also want to make sure while we're tuning in to our kids' needs that we're also focusing on the rest of the family. Partners and siblings can sometimes get lost in the shuffle of caring for a kid with a chronic health condition. And they're often facing struggles of their own and might need support. And when we can attend to the needs of the family, what we're doing is really building that primary support network for our kids. Lastly, we want to keep our kids connected. Managing a medical condition like a cleft can mean lots of missed school and activities, which can lead to disconnection from their friends. We want to try to keep kids connected to the people that they love and the activities that they like to do. So you'll want to coordinate with your school to minimize the impact of absences, help schools understand why kids are out and what supports they might need to stay on top of things. You want to make sure you're prioritizing some time with friends and consider connecting with families who are managing some of the same struggles that you are, like you're doing here through Smile Train. Similarly, fostering resilience in social situations is an ongoing process with different challenge points over time. Individuals with appearance differences who display good levels of social skills have been shown to have greater self-confidence and be more satisfied with the quality and the quantity of their social interactions. So once again, we want to know our kids' unique risk and protective factors. Does your child struggle with speaking up? Are they shy or anxious in social situations? Are they unfiltered and a little bit more expressive? Do they have strong friendships that can help buffer them against social challenges? Knowing these things will really help us to tailor our supports to our kids' unique needs. Once again, we want to work to balance protecting our kids with giving them opportunities to learn adaptive and independent coping. So we can't always, and we shouldn't always swoop in to save them. We want to actually give them opportunities to advocate for themselves, which is going to help them build confidence. Once again, we want to help keep our kids connected. Having a single positive connection with a peer, one friend, or one fun activity that they're engaged in can be incredibly protective against the effects of bullying. Help your kid find their interests, connect with kids who share their interests, and make it a priority that you help them connect. Connecting with other families experiencing similar challenges can also decrease a sense of isolation that a lot of kids can feel and can build a sense of community that will support and strengthen them. When our kids do face social challenges, we want to help them really distinguish between what might be kind curiosity or a question from a peer and behaviors that might be more targeted or hurtful, like actual teasing and bullying. When we can help our kids better understand the situation, we can help them figure out better ways to respond. So you can do that by asking for some context clues. Where were you? What was happening? Well, what did they say? How did you feel? How did they treat you? What did you want to do? What do you wish happened? And what help might you need if this happens again? Having a strategy to manage a stressful social interaction can help to elicit positive responses, reactions, and interactions with others, and in turn can help our kids build their confidence and have a more positive view of themselves. One of the strategies that we recommend helps to target nonverbal communication using the acronym STEPS. This STEPS skill is something we encourage you to practice with your kids to help build their nonverbal social skills. S is for self-talk, which includes positive and affirming statements about oneself. I can do this, I'm strong, I'm brave. T is for their tone of voice. You might want to practice with your child so that they're speaking clearly and at an appropriate volume so that they can be heard. E is for eye contact. We want to help look people in the eye when we're talking, but also when we're listening to help build that sense of connection. P is for posture, so helping your child practice standing with an upright posture, their shoulders back, their head up, and maybe even hands away from their face. A lot of our kids will cover up when they're talking. And the last S is for smile, which really just helps your child communicate their friendliness and their confidence. Many children, especially our younger kids, can get very nervous or anxious when they're asked a question about their difference. And often they'll respond by ignoring it, not saying anything at all, or just saying nothing. And oftentimes those non-responses can actually result in the other person kind of pestering for more information because they might actually observe that there's a difference. Some kids might then make up answers for the questions or just really target or pester our kids, and it can start to feel like bullying. So what we found is that it can be really helpful for individuals with a visible difference to practice a one-liner response to anticipated questions or comments about their appearance difference. These responses tend to work best when they include an acknowledgement of the difference, a brief, age-appropriate explanation, and then moving the conversation on. So what this looks like is first giving kids the language to be able to label their difference. Try to use neutral, descriptive language and let kids know that they can say as much or as little as they want, and that can really vary depending on the person, the situation, or just their mood that day. So what that might look like is a kid being able to say, oh, that's my lip there was open when I was born and the doctor closed it when I was a baby, or that's a scar from an operation I had. Next, we might want to do some reassurance or explanation. A lot of times people will express worry, confusion, concern, or even pity. And providing some reassurance can educate them about our visible differences and also help them understand how we feel and also how we want them to treat us. So we might say things like, I had surgery and it's all healed. My doctors are doing a great job taking care of me, or this doesn't bother me. And last, when we're ready, we want to give our kids a tool to move the conversation on. And so sometimes that's as simple as saying, gotta go, changing the topic, or even asking a question. For our kids who are old enough, I really recommend some role play with a parent. Kids and their siblings and their parents can practice talking about their own visible differences, try on different response styles, or you can even practice with different types of questions. So, like that simple curiosity, a kid saying, "What's that?" Something a little bit more pointed, like, "What's wrong with your lip?" Or even responding to a negative comment, like, "Why do you look like that?" or "I think that's ugly." Writing down a response can be helpful. You can have your kids write that on an index card and keep it in their backpack or their notebook. And importantly, it can be helpful to practice what your child is going to do to respond to these questions before they're entering a new social situation. So if they've signed up for a new team or it's the beginning of a new school year. What we know is that when our kids rehearse their responses, they build their confidence, they lower their anxiety, and they increase their skill in being able to answer common questions. So in summary, we know that there's a wide range of risks and outcomes. And though our kids are absolutely Cleft strong, they're strong because they experience unique challenges related to their social and emotional functioning as they navigate years of medical and surgical interventions. The past year and a half of the COVID pandemic has added to the complexities of these challenges as our kids have been more isolated, more online, and experienced disruptions in their schooling and their medical care. When we are aware of the challenges that our kids face and we can have a sense of their unique risk and protective factors, we can work to provide targeted supports to address their needs and build their resilience. By helping our kids and families overcome challenges, we help them see their resilience and empower them and ourselves to engage more effectively in care to help our kids. One of the most influential factors in helping a child build resilience is having a caring connection with an adult in their life, and that's very likely you. Through your guidance, encouragement, connection, and modeling of effective coping and problem solving, you are helping your child and your community to be Cleft strong. Thank you so much for the opportunity to connect with you today, and I'll look forward to answering questions or responding to some comments. Thank you.
Hi, everyone. Thank you so much for joining CleftCon 2021, and specifically this session, Raising Cleft Proud Children. My name is Julie Bangus. I'm a manager with Smile Train Team Empower, and so excited and thrilled to have Dr. Leanne McGee here with us to answer some questions for our live Q&A portion. So thanks so much, Dr. Leanne McGee.
Hi, I'm happy to be here.
So I have to say, looking through the chat box and the comments so far, I just love seeing these questions come in, the comments and the community already building around. It's fantastic. And I would say to everyone, keep the questions coming. We have limited time today, but we're going to get through as many as possible. And feel free to take these conversations to all of our video meeting rooms, to the connection areas later if we don't get to them. So we'll jump right in if that's okay with you, Leanne.
Yeah.
Excellent. So one of the first questions that came up after a great couple of comments to start was from Anastasia. And she said, I'm wondering how could a parent start a conversation with a 4 to 5-year-old? When are the kids normally ready to talk about it?
So kids are ready to talk about it whenever you're ready to talk about it. I often recommend taking the kids' lead. Sometimes they'll get a little bit curious. But if you're routinely going for cleft care, like annual checkups, that's a really nice opportunity to say, hey, we're going to go see your doctors today for a checkup. And that's a great time to start to say why we're going for a checkup. You know, when you were a baby, you had a cleft lip and palate, and they want to make sure that everything's still working great because you're growing so much. It can be a really nice time to show some baby photos if you have photos of them before and after their repair, so they can talk a little bit about what was different, how much bigger they've gotten, and also give them a chance to ask any questions. Say, hey, do you have any questions you want to ask your doctors? If it feels like, you know, you don't have any appointments coming up, your kid's not super curious, things like, you know, just brushing your teeth, looking in the mirror, you can start to talk about your faces. You know, I love your big brown eyes or your curly hair, or, you know, that little scar reminds me of how strong you are. Can be a really positive way to draw some attention and open some conversation about their appearance.
Those seem like really tangible, actionable tips right off the bat there for especially that young, vulnerable age, I think.
Mm-hmm.
And it seems like there's other questions coming around bullying and teasing. And it seems like those pre-K kindergarten years, which are a general vulnerable time for everyone, I'd say, there's a suggestion about talking about education, maybe talking to the teachers, how they can present on that. Do you have any thoughts on how a parent might
Absolutely.
involve
Yeah, I
them?
think getting to know your teachers is so important because a lot of the questions happen when kids are around other kids, like in preschool and kindergarten, particularly during unstructured times like recess or lunch when kids can chat a little bit more. A lot of times, our teachers, they're amazing teachers, but they might not be that familiar with Cleft and themselves feel a little bit nervous to field questions about it. So I'll recommend that our families, particularly for our kids who have like an IEP for speech and language services or reading supports, take the opportunity to teach their teachers about what Cleft is, about how it's not just a cosmetic surgery that they get as an infant, but it can have a lot of different impacts. And I like to teach our teachers the one-liner. So whatever your one-liner is for your kiddo, to share that with the teacher so that if they hear kids asking, either asking your kid or just kind of talking in general, they can have a really easy response to say, oh, Susie has a cleft lip and palate, and that's a scar from her surgery. Did anybody else ever have a surgery? And then you get to talk and connect and make it a really positive sharing experience.
Wonderful. There's some comments about the steps being a really great resource. I'd have to say that's like super actionable right off the bat. I think, again, anyone of this vulnerable age could take that forward. So everyone seems to love that side of it. Rachel's wondering if she can get a handout of this. So I don't know if we have, I think we're recording this obviously, but
yeah, it'll be recorded. Actually, the steps come from the literature from burn survivors, so folks who are dealing with differences, and it's been adapted to work with folks with all kinds of differences. But I'm happy to see if we can share some of the links and resources so that you guys can use it.
Wonderful. And again, comments on role play, that seems like a really tangible thing that people are going to take right away from the session already. So I do believe we're running out of time. Any final thoughts, questions? Like I said, the response is already wonderful from the group in the chat box so far.
Well, I'm happy to take email questions. So if you want to, keep them coming, I'm happy to follow up. I think the really important thing is to just trust your kids that they can handle so much. They have built so much resilience already. And you as a family have probably built a lot of resilience. Just by opening up the lines of communication, knowing that you can talk about these things, and knowing that your Cleft Care teams very likely have psychosocial supports available to help you navigate when things feel a little bit tricky. And just relying on the community, like the community you're building here by attending this conference and connecting with other families. I think those firsthand experiences are really the most valuable thing, learning from each other about how you're navigating things.
Wonderful. I do see one last comment I want to address. Burton says, my 11-year-old doesn't want to talk about it. I don't know how to open up to her about it. We talked often when she was younger, but it seems like she's struggling as she gets older. So it's kind of like a different stage of their struggles.
11-year-olds are tricky. Those tweens and preteens and teens, things start to get a little bit more private. I think definitely just keep saying that you're here and you're ready to talk about it if they want to, and leave that door open. Maybe direct them online to some resources where they can learn and maybe connect and see that there are other kids who are going through a lot of the very same things that they might be struggling with.
Excellent. All right. Well, thank you so much, Dr. Leanne McGee, for your time and expertise, such educational aspects here. And I would encourage everyone to make use of all the great ways to connect with each other after the session and for the rest of the day. Great things to come. It's only 50 minutes in for the day. So wonderful to have you all with us, and look forward to seeing you all in the next couple of sessions as we go.
Thank you.